Hi, I'm Amy from Mere Wellness and Myofascial Release, and this is
Jessica Stovall. I'm an occupational therapy student at Creighton University.
And we're going to show you how to do legs up the wall pose. Legs up the wall pose is wonderful for so many reasons, and I recommend it to many of my clients. It's wonderful if you have any low back pain, hip pain, hamstring tightness, calf tightness, ankle or foot pain, if you have any lower extremity swelling. It's wonderful to do because it's very calming to the nervous system and lots of other benefits that we'll touch on a little bit later. But first you might be thinking, it's kind of hard for me to get up and down off the floor. That may be true, and we're going to show you in a different video how to safely get up and down from the floor. But think about putting a chair near your mat so that you can get up and down safely. But think of that up and down process as part of your exercise program. Because getting up and down from the floor is a wonderful way to take your muscles and joints through lots of range of motion, and it's really important as we age to make sure that we can get up and down from the floor safely. It's an important skill to have. So, things you will need for the legs up the wall pose. It's nice to have a yoga mat. You don't have to have a yoga mat. Something to give you a little extra cushion. You can use a blanket too, if you like. Having a towel, and we'll explain what that is for in a little bit. A yoga strap is helpful. And if you have a set of therapy balls or even a tennis ball or something like that, you can add a little something extra to the pose that we'll show you. Also, if you have any kind of heel pain, if it's tender having your heels against the wall, having a pair of thick socks. If your feet get cold, that's also helpful. Also, if you tend to get bored easily, having some music or a podcast or a book even or a magazine to keep yourself entertained. Good to do legs up the wall for 5 to 10 minutes. You can do it even longer if you would like. There's not really a lot of precautions with legs up the wall. If you do have any heart issues, pulmonary issues, having your legs up the wall for extended period of times may not be great for you. You might want to do it for a shorter period of time. Even things like glaucoma, any inverted poses can cause increased pressures, so just be super careful with that. Maybe shorten up your time frame or maybe choose not to do it. So for starters, we're going to have Jessica show us how to roll onto the mat. Because you want to roll onto the mat, getting your hips as closest to the wall as you can. But it's not important to have your tush all the way touching the wall. Depends on how tight your hamstrings are as to how close you're going to be able to get to the wall. So sitting down, rolling over onto the mat, and then putting your legs up the wall. So Jess, how does that feel for you right now?
I can't really feel too much.
Okay, so she's in pretty good shape, so she could probably get a lot closer to the wall. So you have some options in terms of increasing the tension in your hamstrings. So we're looking for a mild to moderate pull in the hamstring area, or it might be anywhere actually up in the back of the legs. So our first option is, and I really recommend when you're doing legs up the wall pose, to put something in your low back curve. That helps make sure we're stretching the hamstrings in a very functional position. So having a towel and rolling it up once or twice, depending on how flat your back is and how much low back curve you have. So you can just pull it underneath and tuck it into your low back area. Jess has a really good low back curve, so she's going to roll it up even one more time and then put it right where the back curves. Okay, and then put your legs back up the wall, and you feel more tension?
Mm-hmm.
Okay, so that pulls the hips in a little bit different angle and increases the tension in the back of the legs. Do you feel like you could take a little bit more stretch?
Yep.
Okay, so Jess is going to show us how to get a little bit closer to the wall, and this is another opportunity to move your body differently. So you can put your feet on the ground and then wiggle your hips. You can sit up, wiggle your hips to get a little closer to the wall, and then pull your towel back into your low back curve. And then bring your legs back up the wall, and how does that feel?
Good.
Okay.
I also have my pelvis tilted.
Good. Mild to moderate tension.
Oh.
Now, what we want is just to sit here and wait until that tension just seems to dissipate. And then your choices are to move closer to the wall or add a little bit more on your low back curve. So one way to tell if you're ready to move, if you don't feel a lot of tension here anymore, you can tip your tailbone down towards the mat. The tip of the tailbone goes down towards the mat, and if you feel that increase the tension, then you want to move a little bit closer. Okay, so other things to think about with legs up the wall pose. You want to make sure that your legs fall right in line with your hip bones, and your toes are pointing back towards your head. Now, if it feels like it's a lot of work to keep your legs in that position, what you could do before you even get on the mat is either put your strap around your calves, or at least pre-measure your calves and create your loop in your yoga strap. And go ahead and put that around your legs. So what the strap does is it keeps your feet from falling out sideways or falling inward, and makes it easier for you to completely relax your legs in this position. Okay? Does it feel like you can relax your legs a little bit more?
Mm-hmm.
Okay, wonderful. Now we'll do a couple more positions with the legs in a second, but you can open up your strap and move it down to your thighs, and then let your legs fall apart to get more of a stretch on your inner thigh, and we'll show you that in a second. So another option while you are sitting or reclining in legs at the wall pose is to take your therapy balls and place them underneath your shoulders. Anywhere you have tension in your mid-back, you can even do a little bit of your low back or up around your shoulders, your upper traps. And then play with the position of your arms to find that just right stretch. So while you're getting all this great stretch in your lower body, you could also be getting a stretch across the front of your body and a little bit of pressure into the back of your shoulders to deal with some of the tension that we get up here too. So really making this pose multi-purpose. Let's take the balls out. Okay. Thank you. So if you don't have any balls, you can still really open up your shoulders and work on the tension through the chest and the shoulders. How's that feel?
Awesome.
Okay, wonderful. Okay, so sitting in here for 5 to 10 minutes until you feel that dissipation. Can you get closer with the strap?
Mm-hmm.
Okay, so you can leave your feet up on the wall and wiggle the hips, walking a little bit at a time closer to the wall, and again increase the stretch, working on long-term goal of getting the tush as close to the wall as you can and legs up the wall. So while she's in this pose, she's not just getting a stretch. What she's also getting is improved circulation in her body. So we're on our feet a lot, or we're sitting a lot. We don't always get great circulation in the legs, and this just helps everything move through the body that might be getting stuck here. Also, our lymphatic system, it can help start to move the lymph through the body a little bit easier. It's also very good for the nervous system. It's very calming, very relaxing. So lots of different benefits to legs at the wall pose. So let's take the strap off, Jess. Okay. Another great option when you're in legs at the wall pose is the figure 4 stretch. So you can cross one leg over. Depending on how tight you are, you may only be able to get your foot onto your calf, but bringing it down, if you can, eventually across your knees, and that gives a great stretch in the opposite hip. Now you can increase that a little bit more by sliding your foot down the wall, and now you really feel that stretch in your hip. Yeah, it gives a little bit different stretch, and it feels great. So if your feet start to fall asleep while you're doing legs at the wall pose, you can always integrate a little bit different stretch with your pose. So go ahead and do the other side. Okay, and while you're doing that, you can add the arms and relax there for a little bit. Do some belly breathing. And then another pose that you can do is opening the legs out to get an inner thigh stretch. Opening the legs out nice and wide, letting the feet turn out. And you can play with the position of your legs to get at the stretch you need, because not everybody is the same. We all use our bodies differently. We all have a different history. So playing with the position of your arms and your legs so you get the stretch that you need. Now another position that I like to do, go ahead and put your feet against the wall, leave your knees out nice and wide, and then bring the knees down. Good. Now you're getting lots of stretch through the hips, through the adductors.
Ooh.
Feels good. Feels good. And it's also very good for the pelvic floor. Male or female, we all get pelvic floor tightness from sitting so much. So this is a wonderful stretch for that too. And again, play with the arms, play with the legs. Something else you can do is even practice turning your head all the way in one direction or the other to get a little bit of a neck stretch in this pose too. So, anything I'm forgetting, Jess?
I tilted my pelvis down in this position, and you could really feel it a lot more.
Okay, so that means you could maybe even bring yourself a little bit closer to the wall and even get more of a stretch there. But that's something that you need to be patient with, take lots of time in this pose, and eventually it's a wonderful way to stretch the back of the legs, the hips, the low back, the shoulders, the neck, and feels good, right?
Yeah.
Okay.
Yeah.
So thank you for watching and take care.